everyone. It's Traci. Before we get into today's episode, I want to let you know that this is part one of a two-part conversation. It's such a meaningful exchange, I didn't want to rush it. So we're taking our time. I hope you'll do the same. Thanks for being here. Hello, everyone. I'm Traci Arieli, end-of-life doula and founder of Comforting Closure. Welcome to another episode. According to the 2002 article in the Journal of Pain and Symptom Management, there are approximately 55,000 children that die each year in the United States. Of these, only about 10% ever receive hospice care, and most of them are served by adult agencies that aren't built to meet pediatric needs. Behind these numbers are families, real people trying to care for their children with dignity, presence, and love, often without the support that they need. Today, I'm joined by Dr. Tasha Faruqui, a pediatrician, mother of three, and someone walking in the path of parenting a child in hospice care. We're going to talk about what it means to live with intention, the grief that a parent experiences when caring for an ill child, and the small moments of light that still find their way in. So grab a warm drink, find a comfortable seat, and join us for the conversation. Tasha, welcome, and thank you so much for being here today.
Thank you so much for having me and allowing me to share our story.
To start off, can you tell us about you and your family's journey?
Absolutely. So I am a pediatrician. I'm living in Cincinnati. I am married to my wonderful husband. I have three children, and my oldest is 16, Soraya is 13, and my youngest daughter is 10. And you mentioned journey, and that's exactly what it is. While you started off the conversation talking about pediatric hospice and that we do have a journey within itself, there's always the story before. There's always the story of how did we get there and who we were and who we are. And I think sometimes when we jump to the ending, we miss so many points that happen along the way. And so, I'd like to think of we all have dreams and ideas of what our life will be like. And, my thoughts were having three healthy children. And that's not exactly how things happened. And with Soraya, when she was born, we knew that something was not quite right. And that was due to her having issues with feeding. And so that came early on in infancy. And there was, a long time of me kind of noticing something and trying to express that something was off, but not really being able to put my finger on it. Despite having a medical education, it was still hard to kind of figure out what exactly was going on. Soon enough, though, as things continued to get worse with her feeding, she began losing weight. And that really started a workup. The first thing that we did was get a swallow study at around 5 months of age. And that was just because with her difficulty eating, I felt like she was choking or gagging with eating. And it was with that swallow study that we actually learned that she was aspirating. And soon it was, and to go back to what is aspiration, it's when the liquid is actually going into the lungs, where it really should not be going into that area. It puts you at risk for pneumonia. And so with a child that has feeding difficulties and now a symptom of aspiration, that really tipped off her medical team to, wow, something is really going on. And we started this odyssey of really trying to figure out, what does Soraya have and can we fix it? And so I would say the most acute time was in those first 3 years when we were thinking of all the different possibilities of the different diagnoses that she could have. And many of those potential diagnoses have a shortened lifespan within a year, within 2 years. And there were other things that we were hoping for that can be fixed, where we could get her right back on track to the healthy life that we had planned out for her. About after 3 years, we realized that we may not get that answer and really try to learn how to live with having a child with medical complexity. Soraya ended up getting a G-tube. She had delayed milestones with all of her, typical milestones. We're talking about speech and fine motor and gross motor. But at the same time, she was improving and she was on her own trajectory and getting what we thought better, although we had learned that she will likely never be neurotypical or the child that we had imagined. And that in itself is its own journey. And about 4 years ago, her symptoms changed where she began losing skills and things became harder for her to do. And the most, I think, profound symptom was muscle weakness. And so we had found that she was getting fatigued, but really that fatigue was stemming from her chest wall muscles not being able to actually move the way that they're supposed to. And with those getting weaker, she was what we call hypoventilating and not breathing in enough despite having normal lungs. And so, again, in thinking about having a child at that time that's medically undiagnosed and accepting that she is going to live, and then having things kind of turn again where there's a new symptom, and this symptom is actually a pretty big one where things are changing, and now we're talking about her ability to breathe. Soon thereafter, it began our journey with palliative care, and as we continue the conversation, happy to tell you more about that. And then subsequently, as she continues to decline, we have a relationship with both palliative care and hospice.
And how old is she now? And can you tell me a bit about her as a person, throwing out all the medical stuff, who is she?
Yes, Soraya is 13 years old. The thing that I absolutely love about reading her medical chart, which I know we're taking out the medical, but I think this is very telling in how we talk about Soraya. Pretty much every provider has included an adjective in front of Soraya's name, even in medical documentation, and that word is spunky. And so I think that is a great way to describe her. She is vibrant, she is fun, she is unfiltered, she is genuine, and she is hilarious. There is just something so pure and energetic about her that I have yet to find an adult, a human that hasn't been able to connect with her. She has this beautiful gift of connecting with others. And she does that with true love and curiosity and just completely being authentic. And so it is just something beautiful to see. She also, in many ways, is a teenager. She is into having her nails done. She is into skincare. She is into makeup. She is into music. She's into fashion. These are all things that she loves. And also, being a true teenager, has the ability to sometimes manipulate situations to have her benefit. And so some of the things that we have, negotiated is, can she watch like TV 14 TV shows knowing that her life is going to be limited due to her medical condition? And so these are negotiations that we have to do on a daily basis, but it is a very unique situation and a very unique way of parenting for sure. But that gives you just a glimpse of her personality.
That's great. Now, I know that you spent years trying to understand what was going on. Can you take us back to those early days and what that search looked like, especially through our medical system? And how did it shape your family?
Absolutely. I think that, there is this lens that I have, which is that of a medical doctor. And I think that as much as in my mind, I have always perceived that we wear hats and that, one day I can be a doctor and one day I can be a mother. I do think that at some point we're all one, and I could not separate that. So, as much as I'd like to say that I navigated her journey in those early days as a mother, I really also did it as a physician, and that was a significant privilege of mine. And just knowing kind of to know who to ask what question to, and to even know what subspecialty does what, I think was really helpful in that navigation. I did not feel like anything was missed because I truly asked all the questions that I could and I advocated as much as I could. And I think that that again is a privilege. I think for many families that don't have a medical background and know how to navigate the system, they could be spending time and energy and money on efforts that would never get them anywhere because they wouldn't know where to put the energy. In those early days, it was awful. It was awful in the sense that we felt like we were two physicians. My husband's also a physician that have a child that's undiagnosed. That if there was going to be any family that could figure this out, it was going to be us. So it almost gave us like this false sense of ability, that we would have the ability to not only find out what she had, but also the ability and the resources and the education to fix it. And I think that got us into, a lot of heartache in the sense of, constantly looking, constantly being exhausted, and also having this tunnel vision of really our only focus for 3 years. I can't even tell you what I missed in that time because we were so honed in trying to figure it all out. It was scary. We'd look up every potential diagnosis. I mean, I know nowadays you can Google, but the problem with us knowing what the potentials were is we actually knew what to Google. And in looking at these possibilities, they were all awful. And so there was a lot of fear. There was a lot of, I think, this idea that we had a superpower that we really didn't. And I think that was really humbling. And there was a moment of pause where we had exhausted our resources. And I think those resources are looking at, have we done every test that we can do when it comes to lab work? Have we ruled out everything that we could? At that time, exome studies were new, and we had done one and we had looked for that. The other thing that was really challenging for us to get approved by insurance was a muscle biopsy. And for the muscle biopsy, we're looking for mitochondrial diseases, which was up on the differential. That muscle biopsy was not covered by insurance, so we had to lobby to Congress and we had to change policies, and we did it.
Mm.
We did it, we got it covered, and despite this beautiful story, we still didn't have an answer. And that really humbled us. We're like, okay, now we know our limits of science being in medicine, so that's also a blessing in knowing that there really isn't a whole lot. So we settled into the unknown. And I think that was like the next phase of life is kind of settling into being like, we may never know, and we have done everything. I will say, since I have first met you in the past 2 weeks, we actually now have found the gene that Soraya has. And so that has been a turn, and we can kind of talk about, sometimes when we let things go and surrender, the answer will come to us. And these are things that sometimes we don't have control. And then there's also like, what do you do with this information? So we have found the gene that is likely what is causing psoriasis symptoms is a de novo or spontaneous mutation. And there is at this point only 50 cases. And she's the only one with a complete deletion, which may be why her symptoms are the most severe. But this is something. And whether we'll be able to do anything before she passes or not, we have to be kind of prepared for what we do with this information and how will it help others. And that's kind of the big shift as well, is one, accepting not having a diagnosis, two, now accepting having a diagnosis, but really not having the power, the ability, the time, the finances, the support for further, promoting gene therapy in the way that it needs to be done in order to save her. It's a whole different battles that we're still like literally happening as we speak in the span of the past 2 weeks.
Yeah, that's amazing that you found that, because I was going to ask you, you still don't know. And that is such a big shift. And it's interesting because you went from a place where you were trying to control everything. And then realizing, okay, you can't control everything. There's that limit, as you said, of science. We're just going to be present and try the best we can and really make sure that our family's healthy and Soraya is doing well and as well as possible. And then something happened and you found this information, which is amazing. And I was also you spoke about advocacy just now and feeling very privileged because you and your husband are directors and you know how to navigate the system. And while I'm non-medical, I've had enough clients that I I really advocate. I really push hard for my clients, and uh, most people do not know because they feel like the doctors, it's almost, I'm not going to say it's a God complex. The doctors know, like, are so like above me. They know what they're doing. Um, but even when the doctors do know, you know what's best for you. Everyone knows what's best for, everyone knows themselves so much better than the doctor knows them. And so it's okay to speak up. You should be speaking up. You should be demanding, not because you don't trust the doctor, but because that doctor is your team member, part of your team, not someone who's leading your team. You're leading the team. The doctor is part of the team, and to treat them as a team member versus, you know, doctors are just human. There's only so much they know about you. So, um, but very interesting that you were mentioning that also. Um, Now I know that you just said that you are between palliative care and hospice, and you are incorporating both into into your work or into your lives right now. What changed for you and your family when you invited hospice care in?
No, that's a great question. I think one, I want to start off by really making it known that the world of pediatric hospice is very different than adult hospice. I will also say humbly, that is something that I didn't even realize being in pediatric medical training. So I think that needs to be known that this is something that is hard to define. I think, from my understanding with adults, it's a little bit more concrete with thinking about somebody entering hospice with a prognosis of about 6 months or less. I will say that within pediatric hospice and palliative care, I actually think it can differ between institutions, between hospitals, and what's available. So, for us, I actually learned about how our hospice and palliative care works as we were going through the process as a patient, and not as a trainee, which I just really think I need to expose that because I trained in Cincinnati, and the fact that I didn't even know how to refer or what to do in these situations of when to, you mentioned inviting, when to invite them. And I think that is a question that still needs to be addressed in medical education as a whole, but even in your individual institution. So I do want to say that because I think that there's this idea that maybe I knew when to invite them because of what I do. And I just want to put out there that I didn't. When it comes to inviting them, and you also bring up a great point of like kind of, trusting your doctors to take that lead. I will say that when it came to palliative care, which in our institution, palliative care does pain management, that we had gotten to a point where Soraya was in some pain that was not being it wasn't able to be addressed with what was being offered from her primary care physician, and it was at that point that we asked for palliative care. But I will say that even in me asking was a huge discussion between my husband and I. He works in adult medicine, and he had just some really strong feelings about bringing in palliative care, even though that wasn't quite hospice at that point. And it is the same team at our institution where it's the same palliative care that then does your hospice care. It's just a little difference in services as far as what they provide. So even inviting in palliative care was tough, and really focusing on what we're utilizing them for made it easier for my husband. And as we got pain managed, the other thing that I realized was her needs for her BiPAP ventilator due to that hypoventilation was increasing. So it was me that actually asked, how do we step up our treatment from palliative care to hospice? What does that look like? And I will say that I don't know if I didn't bring that up. I don't know who would, and I don't know at what point. So I do want to also put that out. Like, I don't know how it's typically done, And again, my husband had some resistance about that. But my thoughts were, if she's declining and there's nothing that we can do to stop it, I feel like now's a good time. The other big push for me to want them involved is knowing that she was needing more support from her ventilator. We knew medically, okay, if this continues, there's going to have to be a conversation about a trach. And that was with our medical knowledge, kind of like knowing what's next. Now, how long that would be, is that 10 years from now? Is that 5 years? We don't know, but I am seeing this trend and she's declining. And what I do know is every time I say the word trach, my husband can't say the word. We actually
Mm.
can't have a conversation about it. He starts crying. I start crying. It creates so much anxiety to say the word. Then that's actually how I convinced my husband. I'm like, if we can't actually say the word to each other, we need help. Like, we have to be able to talk about it. Even if it's 10 years from now, let's not wait till the last minute. Let's like talk about it. And is this even a possibility? Like, then you almost, I think as a parent, again, I'm both, you almost worry that you're manifesting something by bringing up potential challenges and discussions that, maybe if I never said the word trach, we would never have to talk about it. And so there is some like almost like gaslighting yourself, like, oh my God, am I making this real? And so I will tell you, this whole time I was carrying so much doubt of like, I really wanted to bring them in, but I'm also like, I don't want to be the one to like make her decline because somehow I felt like I had that power, which I don't. But I will say that that is real. So for anyone feeling that way, I also felt that. And in bringing them in, it was so helpful to be able to have that discussion. And that was actually one of the first things that we brought in out of care who does pain, who then brought in their hospice care team. And they actually helped us with the discussions, but they also helped with additional pain management, such as massage, and then also helped with child life for peds. That's really helps with communicating with the siblings. I will tell you that I actually didn't know what hospice could do until I asked. Meaning all of these things that I'm mentioning that we utilize hospice for, it's not like I had this like pretty printout of this is what hospice can do for you. It was, this is what I need. Can you do it? And the answer has always been yes. And so from that standpoint, I don't know what other hospices do, but I do know that whatever it is, they have been able to help and support from communicating with, for us to be able to communicate as a family, for us to help communicate with her other care providers. It's just been a huge shift in how we look at things and how we live, but it was a challenge to get there.
That there's so much to unpack with what you just said, and I want to thank you for being so vulnerable and open. I think your your voicing of, hey, we didn't want to talk about it because then it would make it happen. That kind of feeling is so prevalent in our culture, that you don't talk about things because you're going to make them happen, as if there's some magic that occurs, some manifestation, as you said. Um, and I get that all the time with what I do. People do not want to talk about death. They don't want to talk about their advanced directives. They don't want to, because it is very scary. We're not, in our culture, we don't talk about aging or illness or death or grief, um, because we're so afraid of it. It's not something, it's mysterious to us. It's not something that we go through. And you, as a doctor, do you think, I know you talked about not understanding pediatric hospice. Did you understand adult hospice also? Because I know doctors don't get a lot of training, if any training at all, on death and how to talk to the family and how to say, okay, it's maybe we should be talking about quality of life instead of length of life, quantity of life. Maybe it's time to let go. In your opinion, as a doctor, is that more of a less of a pediatric hospice, and more of just an overall hospice and dying education, or lack of
I think
education?
Definitely there's a lack in pediatrics. So I will put that out there. And obviously I can only speak from my pediatric residency training where that's not typically built in automatically. We have a lot of discussions on how to have tough conversations, but I don't think tough conversations always mean end of life conversations. So I feel like those are actually completely different conversations. The opportunities are there to learn, but it takes the individual to be interested in it. So, had I had a special interest in end of life care as a resident, I could use my elective time to do that. However, it's not something that is part of general education. In going through med school, and I still learn about adult medicine going through med school, even though that's not my specialty. I will say that has been my first kind of experience with end of life care was with on the adult end.
Mm-hmm.
But I will tell you that maybe that is what has created some biases. It was always a geriatric population. Um, it was always when they already had the tough conversations, and I would be rounding with the hospice doctor. But that also required me to have a special interest in it, and I wanted to like see what it was like, the curiosity. Um, but it didn't really translate to how that really impacts every patient. And so I think that's the difference in the sense of every patient should have the ability to have these conversations, whether you're healthy at the moment
Yep.
or chronically ill with a life limiting condition. And I think that is my aha moment where I didn't get that in med school, where I couldn't translate. The opportunities are there, but how do you spark that interest? And it's not even an interest, it's actually a need. It's a must have. It's not like just for fun, and I think that is it, even considering it an elective, that's all of our patients need to have these conversations. And um, I think, unfortunately, I'm learning this through my journey. But again, part of the reason why I'm talking about this and why I'm sharing is so we can do better. We can do better for other families, and we can kind of expose the cracks so we can do better. And it's not to make anybody feel bad. If anything, I'm putting myself out there to be like, I didn't know any of this, in order to help others. And so I think the conversations need to be had. And you bring up that, 10% of pediatrics, and I wonder, and this is my own like curiosity in talking to our hospice team, like I think that one of the big barriers is not even talking about death and just like, you know, um, there's a mismatch, I think, in our brain of children and death in the same sentence. And from my understanding of just asking around and being curious, it sounds like many households that have a child that is terminally ill or have a life limiting condition, they actually prefer not to talk about it. And so, how does that alter the care? How does that feel for the patient? I have no idea, but I think that again, going back to what hospice does and what palliative care does, how do we get society to talk about it? Because I think that is a huge barrier in itself.
We're going to pause the conversation here. I hope something in this conversation spoke to you, and I'd love for you to join me next week as we continue this journey. Until then, take good care of yourself.